there already is an age limit. You can't treat anyone beyond the average age of menopause in this state, so 51 is the cut-off.
The women in their 50s that I've seen have all been overseas for donor eggs.
Yeah. But that's an arbitrary cut-off that the government made. I mean, why it makes biological sense that at 52 you're incapable of parenting and at 50 you are, I don't know.
So I just wanted to ask a question. It seems quite clear that older is not better, and it might be even worse. And we are making, women aware that there are treatments available with IVF and other things. But it seems to be like a really big public health issue. Are we as a medical community actually doing something to make women aware that this is actually a problem? Because, the woman might actually change their mind.
I might answer that one. 11 years ago, I came up with the egg timer test, which is the AMH test that I wanted to increase women's awareness of running out of eggs and such. And I went on Kerry Ann Kennelly's TV show and did a lot of interviews. And in some respects, I was attacked for that because, I had female reporters saying I was trying to keep women barefoot and pregnant in the kitchen and such and so forth. So I think there's a bit of resistance there in some parts of the community to hear this message. I think we are trying to get it out there, but it's just not getting through. And I think it's because of that natural human tendency to think it won't happen to me because my mum had 3 kids or I go to the gym regularly. I think we are trying. The Fertility Society of Australia had a public campaign about this a few years ago, but it's just not remaining in the forefront of the public's mind.
I think to a certain extent it's also viewed as a woman's problem. And is this on?
Yes.
Yeah, good. And I think it's not just women that should be hearing this message, it is a society message. Blokes are part of a couple and at some stage they also have to be on board with the whole baby idea. I think also the idea that there is never a good time to have a child, there is never a time when it won't interrupt your career, needs to probably be made plainer to girls in high school. I think by the time they're out with a few years of work under their belt and have got into the swing of disposable income and few commitments and on the career trajectory, suddenly there's an awful lot to have to give up. Whereas if they'd started their plan at the beginning of that, they might have been able to factor it in.
Being a primary care practitioner, I think that one of the really important things is that we have an opportunity when we see young women, especially those in their late 20s, early 30s, when we're doing their regular checks, to actually bring up the whole issue of what were their thoughts, are they planning a family, when are they thinking of planning a family, and that's an opportunity for us to educate. But of course that takes time as well and knowledge for the practitioner, but I think that's a very important time to do it as well.
Hi, this is a question about gestational diabetes. I haven't been a midwife for very long, but even I've noticed that there seems to be an increase in the amount of women who have had it. I was wondering, has the rate been lowered, like the test, the number?
To answer your question, yes, sort of. The new criteria for diagnosing gestational diabetes has been argued over for the last 3 years, but we are moving towards a formal acceptance of the lower fasting target and the slightly higher 2-hour target in South Australia. All the public hospitals have signed up to it. But even before that came in, we've seen an increase in the rates of type 2 diabetes within our community, and the rates of gestational diabetes in the antenatal clinics have paralleled that increase. So it has been increasing predominantly because people are getting heavier and a bit more sedentary. When I first started practice, people would tell me that their grandparents had diabetes. Now it's their parents, their siblings, and a lot more Caucasian women are coming to pregnancy already with type 2 diabetes.
Thank you.
Erin, also about diabetes, those increased rates in Vietnamese and Southeast Asian women, were they women in Australia, resident in Australia, although they were? And do they have similar rates in their own original countries?
It's a little difficult to say, partly because the screening program may not be as extensive, partly because these are women who are born somewhere else but have moved to Australia and they may not have had pregnancies in those countries. But I think there's probably a higher nutritional level in Australia, and we do see probably more gestational diabetes because we look for more, so there's those two factors. That probably didn't answer your question.
No, it does. I wondered whether it was a factor of them not being adapted to our diet, a different diet from their...
I'm not sure that anyone is adapted to our diet.
That's true.
So Tamara said Dr. Clark and be put on medication and fine. Pregnancy progresses well. Normal morphology ultrasound. Her blood pressure remains 135, 150 over 85 to 95, and she is now on triple antihypertensive therapy. Routine growth scan, ultrasound scans has been normal. She comes into clinic at 36 weeks and say that she's really she's feeling unwell, have headache, visual disturbances, and the blood pressure at that stage is 160 over 110. On the examination is a cephalic presentation. The symphysiofundal height is 36 centimeter, which is the normal size. She will have some bloods and investigation done, and her urine protein creatinine ratio is 45, so she has some proteinuria. Her creatinine is 71, just slightly in a higher range, high. Urate is 0.42, which is high, and the remainder is normal. She be admitted to the ward for observation, but her blood pressure remains quite high and is very difficult to control, and hence the decision for induction of labor. Now I'm going to invite Professor Robert Bryce to come up now, and until recently, Professor Bryce was clinical director in obstetric and gynecology at Flinders Medical Center. He has had a broad interest in obstetric outcomes over many years, and in particular has reviewed and published the impact of age on first-time mothers' birthing experience based on local data. Professor Bryce.